Hi friends, good evening and welcome to my channel Mokambika Nursing. Friends, here we can discuss important points for exam preparation, and also we are preparing questions for ESIC, RRB, AIIMS NORCET, Insurance Medical Service exam, DSSSB exam, JPHN and CHO exam preparation. Here we can see important points. Let's see the points. First we can see normal hemoglobin count in various age group. At birth, that is neonate, the normal hemoglobin level is 18 to 20 gram per 100 ml of blood. That is 18 to 20 gram per deciliter. And at 1 year, it is 17 gram per deciliter. In male adult, normal hemoglobin count is 14 to 16.5 gram per deciliter, and in female adult it is 12 to 15 gram per deciliter. This is the normal hemoglobin level in various age group. And next we can see each RBC, red blood cells, contain about 280 millions of hemoglobin molecules. So one RBC contain 280 millions of hemoglobin molecules, and one molecule of hemoglobin is made up of 4 molecules of iron. Okay, and 1 gram hemoglobin contain 3.34 milligram of iron. Each RBC contains 280 millions of hemoglobin. 1 molecule of hemoglobin is made up of 4 molecules of iron. 1 gram hemoglobin contains 3.34 milligram of iron. Okay. And 100 ml of blood contain 50 milligram of iron. That is 3.34 milligram into 15. 15 is the normal hemoglobin count in adult. Okay. So 1 gram hemoglobin contain 3.34 milligram of iron into 15 equal to 50 milligram of iron in 100 ml. The next point, lifespan of RBC is 120 days, and the RBC get destroyed into spleen. Okay, so RBCs are destroyed into spleen by phagocytic macrophages. So spleen is known as graveyard of RBC. So graveyard of RBC is spleen because RBCs are get destroyed into spleen. Okay, that is an important point. Lifespan of RBC is 120 days. And the next point, the blood volume of a neonate is about 90 ml per kilogram of body weight. That is after birth. The blood volume of neonate is about 90 ml per kilogram of body weight. Next we can see the coagulation studies normal value. Normal clotting time is about 3 to 8 minutes, normal clotting time, and normal bleeding time it is 1 to 9 minutes by IV method, and by Duke's method it is 1 to 3 minutes. Then normal prothrombin time we can see it is 9.6 to 11.8 second in male adult and 9.5 to 11.3 second in female adult. In some book they mentioned normal prothrombin time is 12 to 15 seconds. They didn't mention about the male and female, only common normal value is 12 to 15 seconds. Okay, so here this prothrombin time measures about the time it taken in second for clot formation. That is the prothrombin time. What is prothrombin time means? The amount of time needed for the formation of clot in second. That is the prothrombin time. And this prothrombin time is used to monitor the response of warfarin sodium therapy. While administering warfarin, we should check the prothrombin time. Warfarin is an example of anticoagulant. Okay, so here this prothrombin time is also used to screen the dysfunction of extrinsic clotting system resulting from liver disease, vitamin K deficiency, or disseminated intravascular coagulation. Okay. INR value. INR value means International Normalized Ratio. Is a standard measurement of oral coagulation. INR 2 to 3 for standard warfarin therapy, and this INR 3 to 4.5 for high dose warfarin therapy. Okay, that is the normal value for INR. INR means international normalized ratio. Prothrombin. If the prothrombin value is longer than 30 seconds in a client receiving warfarin therapy, then initiate bleeding precaution. Warfarin is an anticoagulant. Okay, so if the value more than 30 second, prothrombin value is more than 30 second, means initiate bleeding precautions. The normal activated partial thromboplastin time, we can see it is 20 to 36 seconds. Activated partial thromboplastin time is used to monitor heparin therapy and screen for coagulation disorder. Okay, here activated partial thromboplastin time is monitored during the time of heparin therapy, and during the time of warfarin therapy we should check the prothrombin time. And next one, another important area, clotting factors. Okay, there are 13 blood clotting factors in human body. We can see one by one. First one, fibrinogen, first factor. Second factor, prothrombin. And the third factor, tissue factor or thromboplastin. Okay, and fourth factor is calcium. And fifth factor is labile factor, and there is no blood clotting factor for 6. Okay, and seventh factor is stable factor, and eighth factor is anti-hemophilic factor A, and ninth factor is Christmas factor or plasma thromboplastin component or anti-hemophilic factor B, and 10th factor is Stewart power factor, and 11th factor is plasma thromboplastin antecedent or anti-hemophilic factor C, and 12th factor is H-man factor, and 13th factor is fibrin stabilizing factor. Important point, there is no blood clotting factor for 6. Okay. So here we discuss normal hemoglobin factors, coagulation studies normal value and coagulation factors.